Hello, how are you? My name is Ariani. I'm the student nurse practitioner who's going to be assessing you today. What's your name?
My name is Valeria.
Valeria, can you confirm your date of birth for me?
January 8th, 1999.
So today, Valeria, we're going to be doing a cardiovascular exam. And for that, I'm going to go ahead and wash my hands first. And I'm going to walk you through what normal heart sounds and abnormal heart sounds are like and where they're located, okay? So we're going to start with listening for the aortic valve or area, which is located on the second intercostal space on the right upper sternal border. We're going to be listening with the diaphragm and the bell for 60 seconds. And for the purpose of this exam, I'm just going to go a little faster. Today, when listening to the aortic area, S1 and S2 sounds are present, and S2 sounds are louder on that aortic area, which is a normal finding. We're going to move down to the pulmonic area, listening with both the bell and the diaphragm, which is located on the second intercostal space on the left external border. And in this case, S2 sounds and S1 and N2 are present, and S2 is louder on the pulmonic area, which is a normal finding. Moving down to Erb's point, which is located on the third intercostal space, medial to the left sternal border, and S1 and S2 sounds are present. Moving down to the pulmonic area, which is located on the between the fourth and the fifth intercostal space on the left sternal border, where S1 and S2 sounds are present, but S1 sounds are louder in this area, which is a normal finding. Moving down to the mitral area, listening with both the diaphragm and the bell, where S1 and S2 are present, and S1 is louder, which is a normal finding. Moving down to abnormal heart sounds, we're gonna be describing murmurs, rubs, and for that, usually when we try and listen for murmurs, it's best to listen to them and by asking the patient to take a deep breath in and then out. Usually right-sided heart murmurs are coming from the tricuspid and pulmonic area, which are rare but found, and they're usually heard best on when the patient takes a deep breath. And then when the patient exhales, it is when we can hear left-sided murmurs, which come from the mitral area. So we're going to go ahead and listen for aortic regurgitation, which is when we auscultate with the diaphragm on the lower left sternal border, basically where the tricuspid valve is, on the fourth and fifth intercostal space. So I'm listening for a soft blowing, early diastolic decrescendo murmur. And for that, we ask the patient to lean forward. So Valeria, can you please lean forward for me? And we're going to be listening in the tricuspid area. All right, take a deep breath and then exhale and then hold it. Thank you. In this case, there is no aortic regurgitation, which is a normal finding. Staying in the same position and location, we are going to be listening for rubs as well, which is also with the patient leaning forward. I'm going to go on the tricuspid area and listen for rubs, which tend to be harsh sounds. In this case, Valeria has normal S1 and S2 sounds and no signs of rubs, which tends to be indicative of pericarditis. We're going to be moving down to the other murmurs. So we're going to be doing listening for mitral regurgitation. And I'm going to be having you just kind of sit up again. Thank you so much. And then listen with the diaphragm of the stethoscope to the mitral area. Which in this case, the murmur sounds like a blowing panasystolic murmur. And it's classically radiating, or it can classically be heard on the axilla area. So we're gonna go ahead and listen for it with the diaphragm on the mitral area. Go ahead and take a deep breath and then exhale and then hold it. Thank you. In this case, Valeria has no mitral regurgitation, which is a normal finding. Now I'm gonna ask you to lay on the left side. And we're gonna be listening for mitral stenosis. Mitral stenosis is usually auscultated with the bell of the stethoscope, and it's usually a sound that has to be usually low in frequency, and we're gonna go ahead and listen for it on the mitral area. All right, Valeria, take a deep breath and then out, and then hold it. Thank you so much. In this case, I wasn't able to hear any mitral stenosis, which is a normal finding for Valeria. So when trying to identify S3 and S4 sounds, it is best that the patient is laying on the left side. That's how they're usually auscultated. And we listen for the tricuspid and mitral area, also with the bell of the stethoscopes. And it tends to be, or it's best if we do the listening with light pressure, okay? So we're gonna listen to the tricuspid area with the bell, take a deep breath and then out. And then hold it. And then once again, listening in the mitral area, looking for S3 and S4. So it's, in this case, Valeria doesn't have any S3 or S4 sounds present. S3 is usually a low pitch sound and is heard usually in early diastole, and then S4 is heard in late diastole. And then one last thing will be, I'm gonna ask you to lay flat. And then we're gonna be looking for aortic stenosis, and we're gonna be listening with the diaphragm of the stethoscope on the aortic area. We're listening for a harsh sound. Go ahead and take a deep breath. And then out. And hold it. So in this case, I didn't listen, or I didn't hear any harsh sounds, which means Valeria has normal findings. Thank you so much for letting me do this assessment on you, Valeria, okay?
Thank you.
Thank you.